staring into the camera, care home resident Marion looks a shadow of her former self just 7 months ago. Since lockdown began, the 75-year has lost weight dramatically and become angry and confused about why she can no longer see her family or have physical contact with them. And heartbreakingly, the dementia sufferer's condition has deteriorated. More than 2 million people have seen her photo since it went viral earlier this week. And now, TV presenter Steve Miller has launched a campaign to give care home residents safe visits from their loved ones to stop them from dying of a broken heart. He says, "A lot of the residents in care homes now feel abandoned by their families because families aren't allowed to see them. And some have to see their loved ones behind a glass screen. That is how you treat prisoners. It's no wonder that they are panicking. They are living in Hancock's hell. They have been abandoned and are scared and so confused. They feel depressed, and when the stress of all this builds up, it can lead to cardiomyopathy or broken heart syndrome." Close quote. Another major concern for nutritionist Steve is that many of the residents in care homes are losing dramatic amounts of weight during lockdown and fading away. He said, "In normal circumstances it can be hard enough to make sure dementia patients eat and drink enough. But now these residents are giving up, and when they are offered food, it isn't unusual for them to not want to bother. Lots of families are in agony." Steve has come up with a solution to help families to give emotional support to their loved ones during the pandemic, and he's branded it Hancock's Half Hour. He said, "Each resident would have a member of the family who is given key worker status and can go into the care home for half an hour every day. It's half an hour where a loved one could go in and motivate the residents, give them some love and support the carers and nurses. The family member would always be the same, and they'd be treated exactly the same as a carer, so they would be tested and wear PPE too. Just talking to them and being there, even just for half an hour. The residents are human beings and their basic need is to feel secure. The power of touch will help support many to feel that security." Steve himself knows how difficult this is, as his own mother Sue, 75, has dementia and is also currently living in a care home. Fortunately, he has been allowed to see his mum, but this is not the case for many, so the presenter is calling for standardized rules on visiting across the country. Steve said, "I've always been a conservative voter, but I am embarrassed and disgusted with how the government has handled this situation. The carers and care homes are brilliant and doing the best they can, but I feel that Matt Hancock is out of his depth. With my own situation and my mum, I visit more than once a week with social distancing. I wear a mask, and it's fine, but some care homes don't allow this, so we need a standardized approach. I don't think my mum knows what's going on. She's at an advanced stage now. I think she knew me before, but now I don't know. I don't know if I'll ever be able to hold her hand again. I don't know if I'll ever be able to put my arms around her again under Hancock's hell. We need to do something now. People say that I should start a petition, but I want Matt Hancock to talk to me. He needs to listen to grassroots people." Close quote. And Marion's daughter Karen couldn't agree more. She said, "I am finding it hard to concentrate on anything lately. This isn't about blaming care homes or carers, it's about getting key worker status for a family member, so that I can get to see my mum and provide the emotional support she needs from me." Close quote. And Karen and Marion aren't alone in their plight, as Steve has noted a huge rise in the number of people contacting him with concerns about their loved ones. He admits that many are too scared to do it publicly, as they are worried that it may result in their loved one being evicted from their care home. However, a number have come forward to speak to the Mirror about the devastating effects lockdown has had on their vulnerable family members. Rita, 73, is in a care home in Sheffield. Her daughter, Nettie, says, "I cry every day, and my mental health has taken the biggest hit. As well as Mum being away from all of us, I feel like she thinks she is in prison. I don't know how much more I can take. I really feel like I will never hug my mum again." Close quote. Meanwhile, Marie from Nottingham finds it devastating that she can't see or comfort her dad David, 66, no matter how distressed he is. She said, "We saw him on a one-off visit through the conservatory window. He wasn't able to hear what I was saying and couldn't have the window open. He wanted to touch my hand and couldn't. He was scared and confused and has massively deteriorated." The home said he now doesn't talk to anyone, doesn't want to eat or drink, hasn't got his usual spark, and just sits by himself. "This is not my fun, music-loving dad. And he's only in his 60s. You can see the sadness in his eyes. Never did I think that in my 30s I would have a parent in care with a progressive disease, who I can't see or comfort. Time is precious." Meanwhile, Sophie has had to watch her granddad Stanley, 78, from Belfast, become confused and desperate to hug his loved ones. She explains, "Lockdown has stripped my granddad of his sense of identity, independence, and diminished his relationship with us all. I have watched my granddad disappear before my eyes. And heartbreakingly, Emma says that having no contact with her mum, Valerie, 81, during lockdown has resulted in her becoming completely nonverbal, and she's also started losing weight." She explains, "The lockdown has not only affected my mum, but myself also. Not being able to see her for nearly 6 months had a major decline on her mental and physical health. I got diagnosed with anxiety due to the stress and worry I was under. I was allowed one video call a week, which never lasted more than 5 minutes. My mum clearly didn't understand, and I couldn't get over how much she was declining each week. At the beginning of lockdown, my mum was still able to tell me she loved me. Now she is nonverbal, and I do believe it's from the lack of interaction." The home she was originally in served my mum noticed in July, because I had emailed the owner 5 times in 4 months asking if I could come visit my mum through a window. She is now in a lovely home, which does allow garden visits, but this is still not enough. Close quote. She adds, "My mum does not understand why I can't hug her or hold her hand. She's having trouble eating, and I know if I could help at dinner times, like I used to before the lockdown, it might work, and she might start to put weight on again. If the government orders another lockdown, my mum will not survive. It won't be COVID she dies from, but loneliness." Close quote.